we were going to have a fireside speaker, Sabine Fatima Haq. She's unfortunately unable to join us because of a family emergency. So my apologies on her behalf. Sabine really wanted to be here, and you would have been fascinated to hear her story of how she founded Doctors. However, that also means we have a phenomenal opportunity because I'm going to bring our panelists out first. Each of these women are rock stars, and you are going to have the most fun conversation listening to them. So without further ado, I'm going to invite my panelists on stage. Can we have Isabelle? And can we have Maïa Alexander and Ashu Martha, please join me on stage. Awesome, awesome. They're coming, they're coming. This wasn't a solo initiative. Isabelle Verguin, Ashu Martha, Maïa Alexander. A lot of people try to introduce the speakers. I won't make that mistake because I am going to ask these women to introduce themselves one by one and share with you the phenomenal journey that they have undertaken personally and professionally to create what you've created. So Maïa, will you go first?
Okay, thank you, Devika.
Thank you.
So I'm Maïa Alexaline. I'm a scientist by training, and it's been 15 years that I've worked in women's health innovation. So I can tell about my journey now. Do you want to go?
Yes, please, absolutely.
Okay,
share with them. What brought you to this point?
Well,
why did you find this Live Healthcare? What does it even do? And why is it relevant to all these lovely people?
Well, I started working on women's health because I wanted to tackle all these healthcare unmet needs on women's health that were usually neglected by the more traditional industry. For example, I know that all of you will understand what I'm talking about when I'm saying side effects with hormonal contraception, pain during IUD insertion. Well, this was typically unmet needs that were neglected. So that's why I started to work on that. And then I was really concerned about all these inequalities in terms of healthcare access and in terms of research on the specificities of women's physiology in terms of medical healthcare. So 3 years ago, with my two partners, we founded Live, and it's a company, and our mission is to radically change the life of millions of women suffering from endometriosis. So why endometriosis? Well, usually we know, oh, okay, yeah, endometriosis, it's pain during menstruations. Well, it's not only that. It's a disease that concerns one woman out of 10. So it's 200 million of women in the world. In terms of global cost, it's 10 billion per year just in France. 10 billion. And 70% of the patients are suffering from debilitating chronic pain. And what do we have to face such a major health challenge? Well, we have zero curative treatment, none. We have healthcare professionals that are just starting to be trained on the subject, whereas the disease has been described for more than 150 years. And we have a research that is 15 times less funded than other diseases. So that's why we decided to help women and to provide them means and tools and to handle their symptoms. So we developed a digital therapy to help women manage their endometriosis symptoms based on integrative medicine and non-pharmacological treatments. So it's education, nutrition, physical activity, mental health, and sexology.
That is fascinating. Thank you. And we're going to dive back in and circle back on what that means. But I'm going to invite Ashu Martha to please share more about her organization, Mom and Baby, and your journey.
Hi, everyone. It's really amazing to be here. So my name is Ashu Martha Agbornyenty, and I'm a midwife and reproductive health specialist. So I love to laud the fact that I'm a midwife, and I equally love to identify majorly on the point that I'm not just a midwife who delivers babies, but one who has engaged or embarked on a journey to deliver change as well. So my journey to creating For Mom and Baby Foundation didn't just begin in a day. Being a young midwife, I witnessed the tragedy that so many women encounter, not just during pregnancy, but even before pregnancy, during pregnancy, and after they must have had that baby. And given the numbers, the statistics, given the fact that my country has a maternal mortality rate of 438 per 100,000 live births. That's Cameroon I'm talking about. And we are currently facing a socio-political crisis. And I work mainly in the regions which are majorly affected by this crisis. So it makes it really challenging to get to these women because they don't have access to quality healthcare you would normally expect a woman to have. So when I work with these women, when we engage with them in the community, we get to listen. Actually, listening is one thing I learned during my work as one person who really loves working with women, because I got to discover that I went to this community, yes, I was doing the work, but I didn't quite listen to the women. I kept doing or getting to do innovations or things that I thought was necessary, but I wasn't listening to them. So it was a game changer the moment I began listening to them. It will amaze you to know that these women have so much to share, so much to talk about, and so much pain inside of them, and they just need someone to listen to them. So the For Mom and Baby Foundation is a not-for-profit organization that specializes in advocating for maternal and child health care in Cameroon. And we are very, very passionate about working with these women. And so far, we've reached out to over 2,400 women in those crisis-stricken areas. And we've distributed about 340 emergency kits to pregnant women in these crisis-stricken areas. And so far, so good. We keep getting there. And I believe the journey keeps getting interesting.
Thank you. Isabelle?
Hi, everyone. Super happy to share the stage with those three wonderful women. I'm Isabelle. I'm the co-founder of Jeen. We try to elevate the standards of women's health with Jeen, which are health centers dedicated to women. And I wanted to start to talk with one story. If I say someone is having a heart attack, I think most of you, 90% of you, you'll think about a white male, 60 years old, having a heart attack. But actually, the heart disease is the first cause of death of women in the whole world, and we don't know that. And actually, when a woman has a heart attack, people will start diagnosing an anxiety attack, because actually herself, the practitioners, their closest ones, they don't know that the symptoms of a heart attack are different between a man and a woman. But we have studied heart attack on the male body, so the symptoms of the woman are not super well known. It means that you have 1 hour delay in taking care of the heart attacks for women. And when you have medicine, the medicine, like most of the medicine, has been tested on animals and the male's body, which means that women have twice more secondary effects than men. So this is just heart attack, but actually it's a whole medicine that has been studied on the male body. So we have to review the whole thing here. I mean, there is so much work to be done. And if we just focus here on women's health, we lack of gynecologists. We have so much medical wanderings with endometriosis, for instance, but with so many others. We have this human dehumanization that you were talking about, the lack of listening. So we really need to tackle those topics. And this is what I discovered 3 years ago. I'm not from the medical world. I used to do business and project management, and I met a midwife 3 years ago, Valentine, who's my co-founder, and we really wanted to take this topic and create something big. And this is what we try to do with Jeen, with the first health centers that opened in May in Paris, in the 11th arrondissement. So you can go if you want in the next few days. It's a great place, and I'll say more things, I guess, later on this.
Thank you so much. That is fascinating. Have any of you ever visited a women-only health center? Yes, thank you. And did you have a great experience? Absolutely. I think the conversations we're having here are not necessarily about saying it's men or women. What I hear these three amazing individuals share is about listening, is about collectiveness. And what is happening is that though science seems to have made a lot of advances, it hasn't really. because there are topics which have been not quite talked about: endometriosis, immunization, heart attack for women, from a women and a gendered lens. So maybe I'll ping it back to you, Isabelle, and tell us more about the journey for setting up something like Jeen, a women's health center, funding it, finding people to believe in this mission.
Yeah, I think building a company is hard. Building a company in the health system is quite hard. Building a company in the health system on the woman is like super hard. But I think what's interesting is that today, since the Me Too movement, I think in 2018, voices have been heard. And I think that we started to talk a lot, and I think our voices now reach people and reach the investment world. So the first thing when you create a health center is that it costs lots of money. So we had to raise some funds. And well, the French state is not doing well right now, so it's hard to get public funds. So we decided to create a company with a social mission, but to use the investment of a company to create it. So we did a first fundraise with business angels 3 years ago, and we're actually closing the second fundraising with business angels as well. And I think that people would say it's hard to find investments when you're a human because women entrepreneurs, they raise 4 times less money as men. But I think actually I totally forgot that aspect. And I said, okay, I have a great project and a huge market. I mean, it's 51% of the population. So I have a huge market, I have a great project with lots of impact. I have a business model, and I think it's quite important to say. And I think it can really change the world. There is this McKinsey study that was live, I think, three weeks ago, and that says that actually, if we invest in women's health in global, like the whole world, we can boost the economy by $1 trillion a year by 2040. So I think investing in women's health can really change the whole world, and I think that investments start to hear this. And so we had quite a good echo in the investment world, also from men, actually, which is great. And I think my dream capital is to have men on board because they're totally part of the journey. And I'm happy to see that I have great men really invested in this.
Brilliant, thank you. Ashu, would you like to go next, Ashu Martha?
Yes, thank you very much. And I mean, my journey starting the Form 1 Baby Foundation it's really emotional looking back because, like I said, I'm a midwife, and I'd love to say the Form 1 Baby Foundation is the first ever midwife-led organization. And that's just to tell you that midwife or midwifery is a profession that has been generally underlooked. I don't know about it in your various countries, but in my country, I remember telling my siblings, it's midwifery I want to study. And everyone in the family looked at me like I was speaking jargons. They were like, what are you going to look for in midwifery? There are so many other occupations or professions where you can make a lot of money in no time from now, but you chose midwifery? Are you serious? You know, and everyone was on my head. Everyone was discouraging me. But then, you know, I knew what I was going in for because prior to that time, I engaged in 2 different departments in the university. The first year I studied environmental sciences. It didn't work out for me. The second year I moved to another department, microbiology. It didn't work out for me. And then I found myself in midwifery. And I mean, I remember during the first days of class, I felt really connected to the lecturer, or, you know, to what was going on in class compared to the previous years. And I decided to engage with other local organizations to just, you know, see more about what's there to know about the profession. So I engaged, you know, went to the community, started seeing women. You see a mother carrying a baby on her back and really doing this tedious work. And I'm like, how do you do that? And then I begin this conversation with them, and it just flows. It was really easy. Until now, it's really easy for me to talk with the women. So I remember during one of my first internships as a student midwife, it was really bad because I met this woman who was almost like full term, I think 8 months and 2 weeks pregnant, and it was her 7th baby. And she had little or no idea about what pregnancy was all about. Believe me, it does exist in my country. she had no idea, and I had to take her through the journey. Oh, this is why you're experiencing this. Explain a couple of concepts to her, and then she understood. In that instance, I had the idea, to start writing books, little books this small, because people are scared to read books generally around my area. They're scared to read. Once they see a book this big, they're like, oh, this is not for me. So I decided to put it down in really small sizes, so that it will be easy for the women to just, flip past it and assimilate. And that was good. The very first one I wrote, Making the Most of Your 9 Months, was really good. I mean, the women got it a lot. And after that, I felt like that still wasn't enough. That wasn't enough. I didn't feel that was all I could do. So I went ahead to create a Facebook blog called Marty's Midwifery Diary, which is still existing, majorly to educate women about their health, about all they need to know about, pregnancy, childbirth, and even the motherhood period. And that went on well. And it's still going on well, but just that recently I decided to switch the model a little bit more to advocate more for midwives, so that our profession is going to be more heard. And then after 2 years of running the blog, I was like, there's still something we could do. Okay, so the blog is like the talk part of the work, and then we are going to introduce an organization which is going to be the action phase of the talk we are doing. And that is how For Mom and Baby Foundation was birthed in 2021, April of 2021 to be precise. And so far it's been really good. We've engaged with so many women. This foundation has spoken the mind of so many midwives who feel stuck, and so many women who feel depressed or unheard about health profession, towards the health profession, and we have been able to bridge the gap between access to maternal and child health care. So thank you very much.
Thank you. Maïa. It's a moment.
Well, at Live, we started from the basis, because we were patients for some of us, and we started thinking, okay, what can we do to improve the care of women that have been diagnosed after 7 to 10 years between their first symptoms and their diagnosis. So they have already waited 10 years in France to get a name. Okay, it's endometriosis. And then what's next? Well, if they live in Paris or in big cities, they can have access to expert center where they can receive multidisciplinary care. But in some areas in France, there are no gynecologists. There are no healthcare professionals trained about endometriosis. So they can have access to the hormonal pill, they can have access sometimes to surgery, but mainly they have to find solutions by themselves. So they go on social media and they can access to information that are sometimes relevant, sometimes not. So that's why we created this digital therapy. I mean, it's programs where they can follow, and it's based on integrative medicine. And after 3 months, they become actress of their disease. And after 3 months, we have studies that have shown that they have reduced symptoms, and they are 3 times more likely to have a better quality of life, despite still having the disease, because I'm saying it again, there is no cure. So we have to learn how to live with the disease. So we have this program, but then we thought, okay, how can we get access, give access to this program to a lot more women? Well, we are working with private insurance that are providing access to their injuries. And we are also working with company, because employers, and that is really a matter of hope, they want to handle this problem as well. They are saying, okay, I know that 10% of my employees, I mean, the women part, might suffer from endometriosis. And this has an impact on their work. I mean, it's 11 hours per week of loss of productivity. 11 hours. So employers are taking the problem into their own hands, and they're contacting us. And we are working with several great companies that are offering an access to the digital program for their employees. So That's one part of massifying our impact. And another part is that we are doing more and more scientific studies to prove that this is helpful for women in terms of quality of life, in terms of symptom reduction. And with these studies, we are going to apply to get public health coverage so that all the women in France can have access to the program for free.
Thank you. So I find it fascinating that all these three individuals are doing, there's a common thread here. The common thread is there's a curious lack of education. I don't know how many of you knew some of these amazingly horrific stats. 7 to 10 years, surgeries when there is no surgical solution, access, lack of knowledge. And it sounds to me that you are both anecdotally as well as scientifically trying to spotlight these issues, right? So what would give you the next level of support? What would dream capital look like? What would that world look like where there would be, what's the next mountain that dream capital could solve for you? Okay, I see a lot of smiles. All right, Isa, go.
I guess there are two parts. Education, both for women and for practitioners, and I think we can come back on that because we have lots of things to say on this.
We can come back, absolutely.
And there is this R&D issue, and I think that we can do the most as we can on the patient part, on the practitioner part, but I think we do need support from the pharmaceutical and R&D world. I was talking to a pharmaceutical company a few weeks ago. He was telling me how Jeen is amazing, what you're doing, blah, blah, blah. And I said, okay, what do you do right now on women's health? What are your big projects? And he looked at me and he said, we're not an NGO, so we're not really working on this. I was like, okay, there are quite a lot of work to be done. But so that's this part. And I think on the other side, on the practitioners and women part, I think for the practitioners, I think first is integrating these women specificities, of course, in the studies. And I think it was so true when you talked about the art of listening, which is a huge part of medicine. Now we train our doctors to be super effective on the anatomy part, like the gynecologists, they're the best. But not one time in the 10, 12 years of studies, we will train them on how to talk to the patient, on how to listen to the patient. I think this is 50% of the job, I think.
Radical listening. Yeah. Radical listening. Sounds like everybody here is talking about that. Whether it's climate crisis or health crisis, we need to listen. Please.
All right. So for me, my dream capital will be a beautiful blend of resources stemming from economic, social, and political. On the economic aspect, we have the financial, the financial zone, the big financial zone, which of course we are not for profit. We run on funds, and sponsorings and all that put together because we have a lot of work that we have to do with respect to menstrual hygiene, with respect to pregnancy, with respect to preconception, delivery. All those things need money to keep them running. And sometimes it gets really frustrating because the women get to us and they're like, we need more of these things, we need more of these products, but we are limited because we find ourselves in the low and middle income country with little or no access to all this huge funding. But we are very hopeful that we'll be able to help majority of these women. And then there is a social aspect where we are hoping to have so many more people join us, not just in Cameroon. It shouldn't just be a movement in Cameroon. It should be a worldwide movement because 95% of maternal mortality rates is caused by things that could be wholly prevented. 95% of the women who die, there are things that could be really prevented if only the women had the right access, speak to the right health professionals and, meet the right hospitals. And finally, the political aspect, we need all the networks we can get in order to loud the voices of these women, loud the voices of midwives, and loud the voices of, everything that has to do with women's health. Thank you.
Thank you. Very well said.
Well, in terms of dream capital, I think R&D should be funded. That's what I said. I mean, for endometriosis, research is 15 times less funded than for other diseases with equal prevalence. I mean, it's like the prevalence of endometriosis is equivalent to diabetes for women. And it's 15 times less funded. So we need investments to do research. And at our level at LIVE, we are contributing to research on our program, but also on we have other research programs with institutions and public researchers. So we are raising funds, and we are raising funds to run studies and for our trajectory towards reimbursement. So we are currently discussing with VCs that also want to help us revolutionize healthcare in endometriosis.
Fantastic. So it sounds like we need to identify, which they have identified a problem. We need to plan. We need to invest. We need the data to tell the story, and you're already telling the story. So it's all together. So what in this gives you hope? What gives you hope? You can go in whichever order you want. Go, Isa.
What gives me hope is that there is this huge trend that we see, and we're together on stage, and there were no stage on women's health last year, so we start talking about it. And specifically at Jeen, my hope is that we really identify great practitioners who want to work differently. I mean, they're the DNA of medicine today, and at Jeen we see that they want to work differently. We just need to give them the tools. And we have succeeded in doing that in the first health centers, Jeen. So we'll keep doing that, and we see the impact of women. We have 20,000 women who came at Jeen since the opening, and the feedbacks are amazing. And there is this energy that goes through the women who comes into the center, and I think that by dividing these kind of projects, our projects will empower all the women, and I do think that we're in the right growth, the right path.
So what gives me hope is the resilience of the human spirit, particularly for mothers, because they will go above and beyond to ensure their babies are fine, and regardless of even how they feel, they'll always put up a strong face to, make sure the family is up and running. And that's why we won't relent our efforts to make sure that they are fine. And, health-wise, women's health is prioritized and, made top priority on everyone's list, in every profession. Thank you.
Well, as for me, what is giving me hope is that there is an incredible impulse at the moment on the endometriosis field. I mean, we are finally talking about it. I mean, we are talking about menstruations, blood, digestive symptoms. Sorry about that, but that's the reality, and we are finally talking about it. So it's incredible. Patients are starting to be heard when they talk about symptoms and pain. Physicians are starting to be trained about endometriosis. And there are several national plans that have been launched worldwide, and this will bring funds to research as well. So I think there is an incredible impulse on women's health, on endometriosis. So there is a lot of hope.
Thank you. So what is interesting to me in this whole session here is ChangeNOW's foresight to bring health into a climate space. And this is a room full of change makers, so you may not think anything odd and awkward about this, but up till 2 years back, health people went to their health conferences and climate people went to climate conferences, and we didn't think that healthy people and healthy planet has any correlation. Having this panel and having ChangeNOW organize this and recognizing that unless we center health and we center women's health and we mainstream women's health, we will never achieve the planet we want to achieve. So I think that is what gives me hope. But that is also what brings me to my final question of these panelists, and any of you can offer, is what is the impact of climate on women's health? Studies show us it is disproportionate. What, Maïa, would you like to share?
Yeah, happy to share about that. It's mainly about an ecosystem point of view. And we talk about exposomes in research. There is actually one research unit in Paris that is incredible and doing incredible work on the subject. I mean, what are women exposed to from prenatal up to their death? And they're exposed to pollutants, they're exposed to endocrine disruptors, and for endometriosis, there are studies that are linking endocrine disruptors, pesticides, to risk of endometriosis. Some food categories as well, for example, red meats. Red meat consumption is linked with endometriosis risk. And patients, they are advised to eat more organic food, less ultra-processed food, to diminish their exposure to pesticides and endocrine disruptors, because endometriosis is impacted by steroid hormones. So there is a direct impact. There is the part of the hereditary part, I mean, what our genes, and there is some part played by the genes in the endometriosis, but there is also the part played by the environment.
Fantastic, thank you.
Thank you. So I met this soon-to-be friend of mine, because today is actually the first day I met her face-to-face, Charlotte, and she is the founder of Mukuru Clean Stoves, and I was just telling her, this innovation needs to come to Cameroon. Why? Because so many women in the area where I come from work with firewood, you know, they get the smoke all in their lungs, even when they are pregnant. And, you know, pregnant women have it really difficult breathing, because everything they do, they are breathing for two, eating for two and everything. So when they have this smoke in their system, it makes it difficult for them to breathe, and they start experiencing respiratory distress. So it's very important that so many things, and this is just a typical example of how climate change or, you know, issues like this affect women's health. Another aspect, which is really, really something I recently got to discover, is that breastfeeding is actually something that pushes the agenda of climate change positively. And I'm going to explain. So did you know that formula feeding, you know, and the cans and all those things, after using the formula, you have to dispose of the can. Do you ever think of how that can is disposed? Do you ever think of what goes on? But then there is breast milk in the breast, readily available. The baby can just suck and is filled. You don't have to throw away anything. And, you know, it makes life really easy. So I really think that women's health has a lot to do with climate change. Thank you.
Wonderful. Thank you. We do have room to take audience Q&A, because this is the cool stage, right? We are in the cool collective stage. It's called collective for a reason. So if any of you would like to ask any burning questions while we have these very smart change makers here, by all means raise your hands. And absolutely. Let me bring a mic over.
Thank you, first of all.
Would you introduce yourself too?
My name is Marie Kavanula. I am from Austria. I'm a student currently here at ESCP studying sustainability management, but hoping to one day be as successful as one of you. I'm hoping to get into the field of femtech myself and focusing on menstruation and using the female cycle to your advantage. But something that I've come across just in my own personal tiny little history so far is, how do you manage to stay optimistic and positive with all this also rage against the system and the frustration of what's going on and how little support there is? How do you manage to every day say, okay, this is worth fighting for, I'm going to continue, this is necessary, because it absolutely is, but we're not always given the support that we should be?
Brilliant question, thank you. Absolutely. Let's kick it off here, and then
I'm going to respond to that. So my secret is that I run with a vision. The moment I think it, I do it. I don't give people the room to discourage me. You know, like the instance I told you guys about my siblings. That particular instance, I found a way to encourage them to support me in what I'm doing. And it wasn't quite easy, but remember I told you, I just kept running with the vision. I wasn't disobeying them, but I was just being wise and smart with the way I presented my case to them. So just run with the vision, because the moment you want to pause to say, no, I'll think about it, maybe it isn't going to work out, at that point, you already cool the vision. You already kill it instantly. So once you think it, do it and run with the vision.
absolutely. And we are collective people. Look at this room, look around you. You're all change makers. When we come together, we create magic. And that's what we have to remember and remind ourselves. So we're going to continue this panel. I'm going to request these amazing panelists to please take a seat here, and I'm going to invite the next part of the session. So please give them a rousing hand. Find them. You have seen them. You know their names. Reach out and keep asking them questions. Thank you, thank you, thank you.